Welcome to the OCOM podcast, Modern Medical Education, where we bring experts from the field to talk about the newest breakthroughs in medicine and medical education. My name is Dr. Robert Hasty. I'm your host for the Modern Medical Education by OCOM. And today we have a very special friend of OCOM, Dr. Salil Gupta, and we're going to be talking about paying it forward. Welcome to the show, Dr. Gupta.
Thank you.
So Dr. Gupta, if you could just give the audience a little bit of your background, a little bit about your history.
Yeah. So first of all, I am a retired physician. I grew up in India, in Delhi. I was trained as an OBGYN, and I had interest in improving population maternal health. We have very high maternal mortality in that part of the country. And then I came to United States in 1983, and then I retrained myself as a pediatrician and a newborn specialist. And I have been working on how we can improve the community health. So through my professional work, we try to bring advanced perinatal services in the community hospitals and improve the perinatal statistics. I retired during COVID, and I thought I'll just take a break briefly, but I love my retirement so much because I was able to sleep every night uninterrupted. And that made me took a permanent retired from clinical work, but I'm still deeply involved in a lot of community projects, including partnering with OCOM.
Yeah, and we love you too, Dr. Gupta, and that's one of the reasons why we wanted to have you on the show to talk about your desire to serve and to pay it forward, right?
Yes.
The title of our show, and of course service is one of the core values here at OCOM. Our mission includes caring, and you can't really, have a mission of caring without having a value of service, I think. And I think, exemplifies that more than, I think most, right? Your desire to, do service for the community, for the future physicians, and I'll tell the audience, you were the first one to contribute to the OCOM scholarships here, and we're very, very grateful about that. So,
I felt when I first met you, I said, this is great. This is in my quote hometown Winter Garden, and I must do something for the local community. And I'm involved with a Rotary Club for many, many years, and I thought that will be a good start.
Excellent. Yeah. And, to me, I mean, I've said this, I think, maybe even on the show before, I'm actually really inspired by the current generation of medical students. Their desire to serve and to pay it forward is really, more than any previous physician. I truly think that the current generation of medical students will probably go down as the best generation ever of physicians. They're incredibly bright, hardworking, and they really do want to serve. I mean, last year, our inaugural class of students, they had over 1,000-hour community service, 1,000 hours of community service for 97 students. That's more than 10 hours each on their first year of medical school. Heck, first year of medical school, I mean, when I was in medical school, most of us were just trying to stay alive, right? Yeah. And, these folks are, and we don't require, any community service. This is just a truly altruistic, volunteer thing, which is pretty remarkable, I think.
Yeah. And we can easily double it next year.
Yeah.
We have lots and lots of projects that, I have in mind.
Yeah,
so we'll talk about that offline.
Oh, okay, oh, great. Well, I know that you're involved with the students. Well, the students are doing all sorts of things. They have a student-led free clinic that's being launched, part of the Shepherd's Hope. They're working with the Catholic Charities for their free clinic down in Osceola County. I know that they're working. I know you connected them with Matthew's Hope,
right.
Which is the homeless population here in the community, which I believe he used to be the medical director for.
Right.
And I know that they're moving that forward to do basically a free clinic for Matthew's Hope, that's sort of student-led free clinic, which I think student-led free clinic means that they basically talk the docs into, volunteering and stuff, which is...
We have a medical home for homeless people in Matthew's Hope, and we have several nurse practitioners and, providers. So it's already existent. All we need is people to volunteer, and we have, students and other doctors.
Yeah, and I think that's incredible service work, right? Caring for those folks that really sort of need it the most.
And it's in Winter Garden.
Yeah, that's great. That's great. Right here at home.
Yeah, right here at home. People tell me, "Oh, how come you have homeless population in Winter Garden?" And I said, "Well, because there are a lot of challenges for a lot of people." And I think I told you one time, I worked there for 3 years, and I sat through their intake interviews, and, I attended 4 of them, and it literally, I cried throughout that point because it's just so sad to see things happen to people who are just like you and me. And, things can change, and they're homeless, and they're ashamed of being homeless. They can't ask for help because they are proud not to ask for families, and they sleep in the car for days before they kind of give up.
Yeah.
So I think it will be a great thing for students to be part of this organization and many organizations like that.
Yeah. And hopefully that they find the value of giving, right? If you look at happiness in the world, which we all want to be happy, one of those things that seems to always be a theme of all the literature surrounding happiness is altruism. Are you truly doing something good for others? And it's just like if you do a random act of kindness each day, you're statistically more likely to be happier. Right. And I think that's true. If we can engender that with the current generation of medical students, as they become physicians, and they can hardwire that altruism into their life, I think it'll give them so much fulfillment, satisfaction, and also do incredible good. And I also liked what you said about right here in Winter Garden. People, look at the maps and everything, and they always think of Winter Garden as being this,
elite community.
Close to Disney World. And, people say, oh, well, Disney World's the happiest place on earth. Technically, it's the most magical place on earth, but, Disneyland's the most happy, or the happiest, I guess. But, people don't realize that, there are people in our own community. You don't have to do a mission trip around the world, which, it's great when those folks that do those mission trips. But you can do a mission trip right here and help out, our own community, the homeless, people here in our community, or, not always, the homeless, like Shepherd's Hope, some of the working poor and those type of things that need help, that need help. And, so I'm excited, and I appreciate you for, taking the leadership and helping advance our students along those pathways.
Absolutely. Yeah. It's my pleasure.
Yeah.
And as far as happiness is concerned, you said if we can hardwire altruism. I think we all are hardwired for altruism. And unfortunately, all the ancient wisdom which tells you to do these things are going by the side way. And so I don't know if I want you to bring to this reason why my partner and I wrote this book, is to bring the ancient wisdom through the modern scientific view so people can understand that altruism, gratitude are very basic qualities of our deep consciousness, the higher levels of our consciousness, or what we call the spiritual or the spirit in us.
Yeah, and by the way, I should mention. I'll give the plug for your book. And tell us a little bit more about your book, Ramayan, right?
Right.
Yeah, is that how you pronounce it, Ramayan?
Yeah, Ramayan.
Ramayan.
So it's basically it is as it says, is the epic journey of Ram, who was a living incarnation of what we call God. It's like a son of the God. So he's like himself a God. And it's a very common story. I think almost all people who grew up India and born in India, they know about the basic story. And it ends up in the celebration of victory of good over the evil. And that led to a very famous festival called Diwali that we all celebrated here. But what we wanted to bring was how the simple story of Ram, all the events in his life, and how they can teach today to the young people as well as to the elderly and old or adults the value of moral reasoning and filtered through the neuroscience as we know today. And I think, we can give a lot of examples. It basically tells you the mental health skills that are really needed in today's life. As you know, there is a lot of mental health issues worldwide. So many young people are depressed or anxious and very high rate of suicide because we don't teach people mental health skills. We teach everything about the external world, about the physics, the chemistry, biology, psychology, but we don't teach them the inner world, how to regulate emotions, what causes the development of these emotions. So this book is really meant as a storybook to be told to the kids. So you read one chapter every day. And while you're reading, you have self-reflection questions. So you ask people, what is the value of this event in Ram's life? And how will you react if you were facing similar situation? And then why? And so apply. So it's like a little textbook of mental health development. Hopefully we can introduce this in high schools as a mental health questions textbook.
Yeah, excellent. Yeah, and of course, it's something that we can never talk enough about. The importance of mental health, and not only for medical students, but also for physicians, right? I mean, we had I'd say probably what we looked at as a peak in terms of burnout, which is and obviously that's along the spectrum, leading into depression and other mental health issues, and of course we see a lot of anxiety with young folks, and it seems like we've seen historically record numbers of mental health challenges and some of the younger folks. I will tell you, have seen some recent literature that, it does look like that physicians in general are starting to decrease a little bit of the burnout right now, but we're also seeing record levels of burnout amongst medical students.
Yes.
And, I think there was one study that actually showed maybe upwards of 60% of medical students have at least some signs of burnout during medical school. And
I think Advent Health has done a lot of work on physician burnout. And when I was working with Advent Health, we had over 90% physicians showing evidence of burnout. And it's very rampant in other medical health professionals like nurses and allied health professionals. So Dr. Shivam and I are really working very hard on creating some mental health education tools that will help like a primary prevention of mental health. So we have introduced a curriculum of mental health like a subject. So instead of teaching math, along with teaching math and science and history, we want to bring mental health as a subject. So Dr. Shivam has developed a curriculum from grade 1 to grade 12 And right now it is being implemented in India. And there is over 40,000 students who are taking that. So what we do is we teach and train the teachers first. Well, we don't have, enough mental health professionals to do this. So we teach their existing teachers, we certify them as mental health champions. And they teach this course. And we had published 4 or 5 studies showing that if we are able to teach these students 5 basic skills, it impacts how they do in mental health competencies down the road. And we are creating programs for medical students, other undergraduate students, for physicians, for other healthcare workers. Because I think it's a skill that we all need and were never taught. Right. Even I can remember throughout my med school and my residencies, it was very, softly touched, right, if at all. Right. So I'll be happy to have your medical students go through all of this. It's a certification course, 10 skills. We, in fact, there is a second book that is come out about is Mighty Champions of Mental Health. And we're going to go through that with, other students and physicians.
Yeah.
And faculty.
Yeah. Yeah, it's interesting, if you ever, some folks have read about, Seligman, who was sort of the current father of positive psychology. And, he was a president of the American Psychological Association, about 20, 25 years ago or so.
Yeah, I've read his books.
And prior to Seligman coming out, he actually, and I think one of his early books, he actually done a survey of the literature. And if you look at positive psychology, things like happiness and stuff, it was only like 1% of the literature was focused on that. 99% of the literature was focused on the negative psychology, that the depression and anxiety and schizophrenia and those type of things. And now I think we're focused and mindful, but it's also interesting too. And I'm not sure what it means, but that we've spent so much time on that. Yet, if you ask the average American, what do they want? Happiness, right?
Yeah.
And it's just like our founding fathers of the country used to say, it's the pursuit of happiness, right? They didn't guarantee
process of happiness.
Yeah, they didn't guarantee you were going to have happiness, but they said you can pursue happiness, right? But it's always one of those fleeting things, right? You always have to pursue it, right? You may be happy at one moment, and it may not always be there for you. Yeah. So I think, but you always have to do it. And again, part of our thing back to today, paying it forward, right? It's amazing that doing good for others can actually make you happier.
Right. Yeah. I mean, I think there is tremendous amount of literature on doing good to others. Not only does good to them, but there is an incidental benefit to you. There is a very interesting book. It's called Power of Eight, and it is by a scientist she's from New Zealand, Gluckman, and she studied all kinds of things. How if we all focus on one particular outcome, that the chances for that particular outcome to happen is much higher than any statistical numbers. So they did it on people who were sick, who were going under surgery. And if at least minimum of 8, and it could be, hundreds or thousands of people, focus on one, on that person is going to be better after surgery, the odds of that increases tremendously. So she was just studying on that phenomena, and what she analyzed this information that participants who were praying for others improved in their own personal life. So and again, it seems very intuitive, but there is scientific evidence that helping others is not only helping the community, but it is helping you.
Yeah.
And whether you may or may not recognize it, but the data is very clear that it does help.
Yeah. Yeah. It's like, of course, mortality rates, people with faith, tendency to live longer. And then there's also, I don't know if you ever heard of Neil Prishka, the happiness guru or whatever. I went to one of his sessions one time, and it was like, it's one of those sessions that kind of like, changes your life, right? It was actually a hospital association meeting, and he was the keynote speaker, and he says, okay, these are the things that, have been shown to have the highest outcome in terms of happiness. And he says, if you only remember three things, there were three things that he said. Number one, exercise outdoors at least 20 minutes a day. So I started doing that. Number two is positive journaling,
Yes.
writing down, like the good parts of your day,
things.
and, or you can even, say the best three things of your day at the dinner table and stuff. And then the last thing was, he said, this is the hardest, the random acts of kindness. And so I immediately started doing it. In fact, actually, like the next day, I was at Starbucks. Somebody ahead of me, had ordered, paid for my order. I was just getting a latte, and I was going through the drive-through. Don't judge me, right? But I need my caffeine. But anyway, and they said, oh well, it felt good to me. But I said, let me pay for the person behind me, and they said, oh, that'll be $24. They had all these pastries or whatever. So I said, oh, okay, all right, I'll do it. But I drove off that day, and by paying it forward. I had so much happiness, and it really it changed my whole outlook for that entire day. And he says that you should try to do that every day, at least 5 days a week. And but I will tell you, it could just be something nice, letting somebody in at traffic or opening the door for somebody. But it does change how you feel about yourself too. Yeah.
Well, let me add something to it. You can do random acts of kindness, but if you do intentional act of kindness, in a planned way, it is a lot more powerful. And when I joined Rotary in 1995, that was their motto, selfless service or service above self. If you start thinking about others as part of you, that's really the basis of helping others. It's deeply spiritual in nature. That the spark of God is in everyone, whether it's you or others. Unless I think that you and me are same, I won't really feel like helping you. So people who are helping others, passing it on, there is a deep spiritual insight behind altruism. And just one more thing about Dr. Seligman. I read his book, Learned Optimism. That was, I think in late 80s. And it is remarkable book. And he's the guy who basically came up with learned helplessness as the theory of depression. And he said, we spend so much time on pathology, but we never spend time on healthy living. So he came up with this learned optimism, just change, instead of learned helplessness, change into learned optimism. And I have been called an eternal optimist. And I think there is a very strong logical reason why optimism is the best tool we have.
Yeah. One of our faculty members, he's actually chair of specialty medicine, Dr. Minkus, and he's a guru on leadership theory and leadership development. And he's shared with me the data behind optimism with leadership. And when you can introduce from a leadership perspective optimism to a group, your creativity, your problem solving, organizational outcomes is improved, and I there's actually evidence behind being optimistic, and I think that's the same is true for physicians too. I think even with patients, right? I think when there's hope, right? That's has always been one of the tools in our toolbox is to help give patients hope. Even when things look kind of bleak, but there's always some hope, that can be in there. Maybe hope just for a better quality of life, their last few days of life or whatever it is, right? But
Yeah.
there's always that hope. Yeah.
Yeah, I think this is the way I look at why optimism is logical, is that past is something you can't do anything about. You can learn from it, but you can't change it.
Right.
Present is all what we can do. Future is always unknown. So if the future is unknown, why not create something which is a happy ending or a healthy outcome? You know that when you are thinking about outcomes on future, it may or may not happen, but the more energy you put in a healthy outcome, the odds of that actually manifesting is higher. And that's what, you've heard about the law of attraction.
Yeah.
So if you have positive affirmations, and I have had personal experience with many of these things, and I routinely do this, and I'm just amazed at how many times positive outcome happens because I'm putting my energy into those outcomes. And one interesting side effect is that if you're focusing on a positive outcome, you're avoiding all the negativity, all the negative outcomes, because your mind is focused on the positive outcome.
And you're trying to make that narrative happen, right? You work on things, narrative. Of course, being right next to Disney World, we know a lot about happy endings and stuff like that. And there's something to be said, right? If you start with the end in mind, focus on
Stephen
positive
Covey,
outcomes. Yeah, that's
Seven
right.
Habits.
Yeah, I love it. Yeah, I love it.
Begin with the end.
I love it.
So that's great.
Well, I'll tell you, it's been incredible to talk with you today. Any last thoughts for our audience, about paying it forward or making a difference for the next generation?
I do agree 100% that the Z generation, is it called
Gen Z? Yeah, Gen Z, yeah.
Gen Z, they are more focused on benefit to the community
Yeah.
than in general population. But my last word will be optimistic, be helpful to others, and it will help you.
Love it. Yeah, great advice. Well, thanks again, Dr. Gupta.
Thank you.
Thanks again for joining us for another episode of the Modern Medical Education OCOM podcast. And again, thanks to Dr. Gupta for joining us. This is his book, Ramayan. It's available on Amazon and wherever else you want to buy books. And we'll see you at the next episode. Thank you.
Thank you very much.